Hello, and welcome to Converging Dialogues. This is Xavier Bonilla. In this episode, I'm very happy and pleased to bring the conversation I had with Michael Stein. Michael is a physician, he's a health policy researcher, and does a lot of work in public health. He currently serves as the chair and professor of health, law, policy, and management at Boston University School of Public Health. He's also been a professor of medicine and director of behavioral medicine and addiction research at Brown University. And he's studied a variety of topics over the past 3 decades, sleep and pain, HIV, AIDS, addiction, mental health. And where a lot of his work focuses on now, and which we talk about in the conversation, is on public health. And that's something that he's very much interested in, doing research in, and that's really where his kind of network is now. He's written a handful of books, Accidental Kindness, and the one we talk about mostly in the conversation is Me versus Us, A Health Divided. So we start the conversation by talking about that. What is the me versus us narrative of healthcare and public health? We talk about the biopsychosocial model. We talk about how people, how do we get people to care about the health of fellow citizens? Is there any progress on caring about health in the United States? We talk about the U.S. public health versus global public health. So how does the U.S. kind of compare to the rest of the world and vice versa? Just sort of a comparative analysis. We talk about preventative care versus reactionary care and why that's really important to be focused and pushing more for preventative care. We talk about some of the issues from the pandemic. We talk about public health as process and practice. And we also talk about the future of healthcare and the future of public health. Obviously, many things get written about in terms of healthcare and public health. And it was just really wonderful to have Michael on to talk about both of those, since he's been in both worlds, but really to show why public health is super, super important, especially coming out of a pandemic. And even if we didn't have the pandemic, why that's important. So I think it's a really, really important conversation. I really, really enjoyed it. I got a lot out of it. And as always, you can find this conversation where podcasts are found, but also on my free Substack, convergentdialogues.substack.com. So subscribe there. Also on YouTube, again, where all podcasts are, you can find it. So follow me there, and I greatly hope you enjoy the conversation. So now I bring you Michael Stein. I'm here with Michael Stein. Michael, thanks so much for coming on the podcast. I'm looking forward to this.
I'm delighted to be here. Thanks for having me.
Yeah, that's great. So before we get into your book and some of what you've written about, just tell listeners, who you are, what your professional background is in, and what you currently think about and study.
So I am trained as a primary care physician. I've done research for many decades, particularly around the intersection of mental health, addiction, and primary care, and have done policy work, which eventually led me about 6 years ago to a public health school where I now teach at the Boston University School of Public Health, where I'm chair of the Department of Health, Law, Policy, and Management. And so I've written Me versus Us because I am a doctor who is betraying doctoring.
Yeah, no, that's a funny way of putting it. Your book, very, very, kind of bite-sized short book. So it's very digestible, if you will, for folks. It's not, you didn't write, 1,000 pages. It's really, really good. It's really accessible. It's called Me versus Us, A Health Divided. It's really, really good. And that was the sense that I got. You kind of do this kind of thing of, what about medical care and what about public health, and are these in opposition, or where's the overlap? And so, I guess to start out by defining that, if you will, how do you see medical care, and how do you see that as, similar or different from public health, maybe at large?
Yeah. So the title of the book captures it, right? So the ethos of self-help is really ubiquitous in the United States. And by self-help, I mean anything that you do to take care of yourself, which includes medical care. But it's all about, for Americans, individualism, right? That life is an individual journey. It's the story of me. I make my own career. I make my own successes and failures there. I pursue my own happiness. And therefore, of course, I can optimize my own health. And if I don't happen to optimize my own health, well, I can always turn to a doctor who I can see one-on-one in their office. So I call this sort of the me perspective, which is both the medical perspective and me, meaning I perspective. And I set that against the public health perspective or the us-oriented perspective. And that's where public health asks each of us to think of ourselves as part of a group. And that's a hard thing for us to do. And there's a divide between these two perspectives, the me versus us, that I think we see playing out in lots of societal arenas at the moment, but none more so than health.
Now, is this? I definitely see the framing here, but is it always that way, right? So another way of asking this is: could medical health be more collective and public, and could public health be more individualistic? I guess how is it? Is it really a kind of two buckets kind of thing here, or is it? Is there more gray here?
So, yeah, you've gone, of course, to the end of the book, right? Which is,
yes.
As a person who lives in the world of medicine, seeing patients in my office, and lives in the world of public health by training public health professionals and teaching in a public health school, I want to believe that the two perspectives can be merged, can come closer together. But for the sake of this book, I've obviously set the two in contradistinction, in opposition. And I really think that the opposition is based, in partly in reality and partly, again, as a sort of tactical device for this book. But it really reflects the fact that we pay attention to, we spend money on, we resource very differently the worlds of medicine and public health. And so the book is really an explanation or a hypothesis, really not an explanation, but a hypothesis of the reasons why we Americans have come to favor health care over health. And the two are different in my mind. But clearly, we spend a lot of money on health care and very little on public health, even though we've just been through a pandemic. Yeah, so I was going to ask, so how do you define health? And then I guess also, how do you define health care? What's that distinction there? And how do we understand that it's, not just our physical bodies, right, but also our mind and our social aspects as well? Yeah, so I define them this way. Well, let's start at this way. If you have a conversation with anybody, if you go to a dinner party, if you go to a bar, if you say to anybody, how's your health? Tell me about your health. Within probably 34 seconds, it's a great parlor game, actually. Within about 34 seconds, people start telling you about their latest medical visit. Right? So when you use the word health, they immediately take you into the world of healthcare. And by the world of healthcare, it's those activities that we know well, right? It's seeing doctors and nurses. It's going to emergency rooms or getting hospitalized. It's taking tests. It's taking imaging scans. It's paying for expensive medicines. We understand healthcare. We spend $11,000 per American per year on those activities that we call healthcare. And of course, it's not really healthcare. It's really sick care. Yeah. People will say, ironically, that you only do this when you're sick. On the other hand, there is this thing called health, which I equate in the book and in general with public health, which is, what are those conditions of the world that make it so that you can remain healthy? What are the air, water conditions? What are your economic conditions? What are your neighborhood and societal conditions that allow you to remain healthy? And by healthy, of course, I mean to stay away from doctors, so that we can talk about our lives, not in terms of sickness cure, but in terms of keeping healthy. So that's the distinction I have in my mind. The medical care system, the healthcare system is dominant. And what the book asks us to do is to think about how is it that we can turn it around and make public health thinking and practice more central to our society. And I can tell you why that's important in the end. But you started by asking me, are these two really in contradistinction? Are they really two opposites? And the answer is yes, they really are. Not in every person you meet, but sort of, I think in the public imagination, they're really quite different, but they're bridgeable. And that's the last part of the book.
Now, what do you think about this idea, or this model, I should say, of, the biopsychosocial model, right? This is something that's used in maybe ancillary professions. I don't know if medicine uses it formally, but, this idea of the body being, integrative, right? And that multidisciplinary sectors should be involved, right? How do we look at our body, right? But how do we look at our psychological and our social kinds of interactions? And it sounds a little bit like that's what you're saying, based on like health is kind of where we're at, kind of what our environment is, how are things impacting us? I think, the environmental and social pieces, and then obviously psychological aspects such as mental health and many other pieces as well. So what do you, I guess, think about a kind of model that way that's a kind of integrated approach to health?
Well, I absolutely think as a physician, it's the right model, right? That there's an emotional piece that's generated with every illness, that people suffer, and the experience of illness is that form of suffering, and that is contingent on and directed by and influenced by a variety of interactions we have in the world, right? That are from those who are living with us to those who are living outside of our house, but in our neighborhood, community, city, and up. So there's a variety of, social factors that drive our health. I would argue that the biopsychosocial model, which is really, in the end, reasonably sort of individual centric, doesn't spend a lot of time, as do other sort of theoretical models of health, on sort of the policies that drive health, which in the end, I think, are sort of the work of public health in part. So public health is a bunch of things, and we can talk about what it is and why it's so confusing to people what public health is. But I think that the biopsychosocial model is certainly a terrific place to start. And physicians who aren't aware of that are obviously missing something about their patients, I think.
Mm-hmm. So I guess that I'll play devil's advocate here, right? So the one thing that many people will say, or a lot of people will say, is, well, look, my health is my own, right? I got my own body, I got my own stuff, maybe my family a little bit, but most people aren't going to be worried about other people's health. I'm like, yeah, I don't want someone to get sick necessarily, or it's really sad, but why do I need to care about people in the next town or the next district or the next state or the next country? Maybe country's too broad, but in the next town or district or county over, why do I care? What if people need to work on themselves? How does that perspective there change, if at all, if it changes, of being nominally interested in the health of people, of your fellow citizens?
Yeah, very fair question, and a reasonable question. One you always have to try to answer, because we are naturally selfish animals, and you're saying, I need to take care of myself, which I think is, as I started, part of our sort of individual ethos. And I guess what I would say is, well, let's start very practically. Mm-hmm. I mean, when you got on a plane or went into a store during the past 2.5 years and somebody started coughing near you, mm-hmm. You think to yourself, oh, well, I may be sick tomorrow. This person may have transmitted COVID or some other virus to me when I'm there. Mm-hmm. So clearly, we've had 3 years of being hit over the head with this idea of, well, my health is certainly influenced by your health in the most literal way,
Mhm.
one-on-one next to each other. And that's the simple case of, infectious airborne diseases. My health is influenced by your health. So that should be easy. We should care about, and we talk about this all the time, right? Whether people should be essential workers, worked during this pandemic because they needed paychecks and they didn't want to stay home and not get a paycheck. And since we lack the policy of paid sick leave in the United States, we had lots of transmission happening out in the world because people who were ill, were interacting with people who weren't ill because they couldn't stay home when they were ill. So clearly there's policies that right there drive you to be influenced by the people you come in contact with. But to even take it sort of a step beyond that,
Mhm.
and again, it's very hard to change the mind of a selfish person. They could say, well, I'm not an essential worker. I can stay home in my apartment and I cannot see anybody and not interact. And as long as I, go to my private gym and work out and buy my right foods, I'm taking care of myself. So again, I always hear your voice, Javier, in the background saying, tell me more, explain it more. It's not quite good enough. So, I mean, if you just think about, a school shooting that we hear about all the time, or a shooting at an office building, or at, a synagogue or a church or a mosque. Well, somebody killed those people, and that is the health of those completely innocent, blindsided people is affected by, obviously, the mental health of this person who walks into their place of work or worship. When you hear on the radio that there's an outbreak of measles happening and there's over 1 million now unvaccinated children in America, some of them might be in your child's classroom, you go, oh, well, I guess there are other people's health who could affect my kid's health. Or when you learn that your aunt has been killed by a drunk driver last night, you suddenly become face to face with the fact that you are at the mercy of the behaviors of others. And you can deny that, in those very immediate instances because you don't know somebody with measles and your aunt hasn't been killed. But if you extend that again from the COVID example to all of these other sort of common examples now in the United States of guns and other infectious diseases, and then expand it further to polluted waters, and you have an entire city of Jackson, Mississippi shut down because of contaminated water, or that you live next to a power plant or a coal plant. Again, the air around you, the water around you begins to affect you. So the notion that we sort of live in a bubble and are forever sort of safe if we go to the gym and eat well and sleep right just seems to me, ignorant. And you can have that selfish view, but you're missing something. So just from the view of sort of what can come and get me, one should think about others. And then, of course, there's sort of the moral issues, and we can talk about that, which is, what is it like to live in a country where the wealthiest people outlive the poorest people on average by 20 years? Like, is that the kind of place we like to live? So that's more abstract than being infected by the person in the bus next to you. But they're all on a continuum as I see it.
Yeah, I think, I obviously was going to ask you about the pandemic and we can get to that. But I mean, I think that yes, I mean, people I think are inherently selfish, but I also think that, a large reason why we've been successful on the planet for, 50,000 plus years is because, we have a huge history of cooperation, right? How do we cooperate with each other? So there's definitely a bunch of things going on for us, but it makes me worried where, these types of things, when you get it down to, it's whether we like it or not, it comes down to dollars and cents, right? People will say, well, yeah, I care about my fellow neighbor, but, I don't want more of my taxes going to a healthcare system, right? Which again, I understand is different than health. But so I think people could say like, well, I care about your health, but I don't want to give more money, to a system that's not going to use it well or whatever their reasons are for it. And I think it becomes pragmatically super hard. I'm reminded of, of course you remember this. I'm reminded in the summer of 2009, going into the fall, and then kind of dying in around Christmas time, and then getting resurrected after January, and then having these long debates about what is now the Affordable Care Act, and finally got passed in 2010. And for some on the left, it was too much of a compromise, and for people on the right, it was death panels and socialized medicine. But I remember having those people kind of nationally, we were having this kind of debate about healthcare, and like how do we organize as a country, how we want to do this. There's obviously so many issues with healthcare in the United States. And that it was in terms of rankings, however much stock you want to put on that, it was definitely outside the top 25, I think. And it was all these issues, many issues. And what we got was a kind of, I guess, a fair compromise of sorts, which is how politics work. But I remember those conversations, people were having animated discussions about whose responsibility is this, right? So there's the whole like government states thing, okay, but even I think more kind of the moral question you're hinting at here is, why do I need to care about this? How do people get to care about this, right? You can hear all the stories about someone's family member that died of cancer, or someone that has multiple sclerosis, or somebody that has ALS, or whatever it is. We hear those stories, but it doesn't seem like it really seeps into somebody to say, yes, I want to be invested in this. So I guess we've been having this discussion, I guess at least about healthcare, and we still have this, right? What is it? Try to be repealed, 60 plus times, all these things. And there's obviously still issues now, right? Prescription drugs, things like that, and, the cost of meds and various things. But I guess my question here is we've had these debates over the past, call it, 10, 15 years. I guess, where do you see how we've made any progress, right? You can look at the pandemic recently and say like, well, an emergency, a global emergency, we made progress, but at the same time we didn't. People became very tribalized over this issue. I guess, how do you feel for the United States, at least, where the culture is, I guess, about how we care about other people's health?
Well, you have a lot of things going on in that question, so let me try to.
It was a little long-winded. Sorry.
Okay, no, it's a good set of questions in there. So let me start where you started, which is, again, how do you get people to care about one another's health? And we're back at that. It's a very hard answer, and I think part of it is sort of just how you think of this idea of health, right? If I said to you, do you want to pay for a fire department? Like, why should we have a fire department? Like, it's pretty rare that you have a fire. And, if you have a fire, some people could get together and bring some water, right? So we have decided, for historical reasons, since Ben Franklin started fire departments in Philadelphia 200, 300 years ago, to say that there's things that we call public goods that we want to pay for as a society. And we've decided that fire departments is a good thing. And if you get rid of fire departments, it's not like you're going to have fewer fires. You'll just handle them differently. And so I like to think that public health should be thought of as a fire department in a certain way, that it's something that we agree is important as a society. We could change our minds. We could get rid of fire departments. We could get rid of public health departments, but we must think that there's some advantage to having them. And there is this public good, right, around this. And it comes up at the times of other disasters. What do we want to have in place when a hurricane comes? We want there to be mutual assistance. We act because we're generous people who don't know one another. We're at risk in the setting of a hurricane, and we hopefully help each other. But again, you could have no system to take care of people before a hurricane, during a hurricane, or after a hurricane. So these are very complicated decisions that we're making all the time through our politics. And, you're asking sort of, how does the process of complicated decisions get made in the United States? And the answer is, well, you do have these conversations year after year, generation after generation, because they're complicated and because we basically decide to put things back on the table. We don't say we're going to defund fire departments, but at the last few years, people have talked about defunding or limiting the funding or changing the direction of funding is likely where the politics will take it of police departments. Mm-hmm. So we make these decisions as sort of societies in slow motion with antipathy and sometimes sympathy, and we get together to do them. Now, that's one part of your question. Second part of your question was, well, what about the ACA? Wasn't it a compromise? And of course, the ACA was a tremendous compromise at the time in a very complicated world with lots of money and lobbying groups around and lots of disagreement about what the right models of delivering healthcare in the United States was, right? So ACA was a question of money, it was a question of delivery, and it was a question of quality. Those are always the three things that people talk about with healthcare. Mm-hmm. And compromises were made, I think, in absolutely the right direction, right? We've had the lowest rate of people who lack complete access to healthcare that we have had ever in the United States, right? Which doesn't have universal health care, which doesn't seem to believe society that health care is a right. So we made a compromise and we, got rid of 30 million people who didn't have health care and we gave them health care. So I think that was a terrific direction. Now, has it saved money? Well, no, it actually probably hasn't saved money. In fact, it's probably cost a lot of money to us because more people now get health care. And so that's good until you sort of change the system completely where people get more preventive care and public health is paid attention to. You can't really ever change the cost of that care because, you haven't solved all the edges of the problem. But from my mind, limiting the number of uninsured in America is fantastic. And there's lots of evidence that in terms of from everything from bankruptcies, right, which is usually caused by medical costs, all the way to mental health care services, all the way to general quality measures, the ACA has been a fantastic success, but also sort of morally in the right direction. So the third part of your question was then, well, are we making progress? And my answer to you is really written for this book, Me versus Us, which says, well, we can't get at the major drivers of what's causing our problematic life expectancy, which is the measure for a country of public health. We can't fix those things through the healthcare system. The only way we can make those things better is through public health and funding public health. And those things that cause the United States to have dropping life expectancy are public health matters. They're guns and drugs and cars and housing and other things that sort of come from the way that we live. But please remember that, in the 1990s, America had exactly the same life expectancy as Germany and Spain and most of developed Europe. And 30 years later, we are considerably worse, right? That American babies are more likely to die before they turn 5, and American teenagers are more likely to die before they turn 20, and American adults are more likely to die before they turn 65 than anywhere in Europe. Mm-hmm. So Europe has a better life outcome than the United States across the board. That's for white and black people. That's in high poverty areas and low poverty areas. So if you ask me, are we progressing? I would say absolutely not. We've gone in absolutely the wrong direction. And I would attribute that to the fact that we spend money on healthcare, which will never change our life expectancy dramatically, and no money, 40 times less money per person on public health, which is the only way we can change life expectancy. So if you want your children to have a longer expected life when they're born, put your money in public health now because already we're slipping.
Yeah, well, I wanted to ask you about that in terms of kind of the United States with the rest of the world, right? So I hear this a lot, and so you'll hear certain politicians go on about the Scandinavian, healthcare system, and other countries in Western Europe, and even some places in Latin America, or maybe other places as well that have they just have a really good healthcare system. But in public health. So that question there is that, well, how do we get to that place where obviously each country is different. Each country has their own set of norms, their own set of values, their own set of things. How do we get to a place where, okay, how does the United States treat public health, and how does, other places, so we use Western Europe here, they do it differently. So we don't have to emulate exactly what they're doing, but maybe there's things that we could, pull from, or say, hey, they got some good ideas, or they're doing some good things over here. How do you think U.S. in terms of public health sits just kind of on the global stage, if you will?
Well, first of all, the way you get there is by having conversations like this about books like Me versus Us. I mean, this is what you do in a democracy. You have conversations until you try to convince people that they're doing the right thing or the wrong thing. But to say, to hear constantly that, we're an exceptional country with the greatest healthcare in the world, and yet at the same time be 40th in the world in life expectancy, and 40th in the world in infant mortality, that is at the bottom of the list of developed countries, is just facing some facts that nobody says aloud and nobody wants to talk about. So first thing you have to do is know the facts. We're 40th in life expectancy and infant mortality. Number two is you then have to say, well, that's unacceptable to us. Why is that? And how do we change that? And so those are the first two steps. And I think we have to have those conversations out loud. Now, my argument is in this book is because we spend vast amounts of money on healthcare, far more than any other country. And those other countries that are the top 39, when we sit at number 40, they spend money on things that actually improve longevity and improve health status, such as public health, preventive care, social supports. So they're moving their money in different pots. They're not saying, well, we still need to spend all this money on healthcare, and we now have to tax more to spend all this money on these other things. Now, many of these countries tax higher than we do. Scandinavia taxes far higher than we do. It gives its citizens, the citizens have decided, in a sense, to give themselves certain services that we so far have not decided to give ourselves in the United States. Okay, I accept that we still don't, do free college or free pre-K like they do in those places, that we don't value education like they do in those particular places. But what we've done in the United States is overvalue healthcare. And that's the problem. There has to be, and what this conversation we're having now is talking about, is really a shift of where money goes, where resources goes, because as you've said, these resources, these funds are what drives America, right? If you don't value it, if you don't pay for it, you don't value it. And so if we're not going to value public health, and if I can't convince you that the matters of public health are what going to make us live longer, then we'll be where we are. We'll be 40th, and that's okay. That's where we'll stay.
So to this point, then, is it the fact in other countries, is it the fact that there's an emphasis on social programs, preventative and proactive measures for public health, as opposed to more reactionary ones? And is that some of the problems for the United States here?
Yeah, it's a two-part problem. So yes, there's much more money, right? They spend $2 in social support for every dollar that they spend on healthcare. We spend 90 cents for social support for every dollar we spend in healthcare. So we spend less than half of what they spend on these social supports. And the second additional problem in the United States is that we overpay for healthcare. There's just a lot of money in healthcare. And one could argue, that there are some good reasons why we spend a lot, that it's a major employment vehicle, that nobody, the major employer in many small and middle-sized towns in the United States is the healthcare system. If you take money out of the healthcare system, people will be unemployed. There's this whole circular argument. But the fact of the matter is we don't pay as much attention to social supports, and we overpay for extremely expensive healthcare. And you see this sort of playing out in its simplest forms look at how much we overpay for medications, right? That's one that's hot in the news all the time. Why do we pay so much more than Canada? We pay so much more for hospital rooms. Why is that? Why do we have so many scanners? Why is it that is so important. So, there are pieces of it, two parts. We underpay for social supports, we overpay for healthcare, and therefore public health doesn't have money to do the work that we need it to do.
So again, it's interesting because I feel like in many ways, not just in public health and in healthcare, but I think just in a lot of things, it does feel like the United States is reactionary. That's not to say that other countries aren't reactionary as well, but I guess, and I would say one of the push in the ACA was trying to, I'm thinking of women's health in particular, trying to do preventative measures, right? And trying to put more of that there. I mean, even if let's take out the social programs for a minute, right? Because I know that gets all like, with money and politics and all that stuff. But even that piece of it, right? Getting good screenings at the individual level, getting good screenings, being able to get a free annual exam, all these things, like these preventative measures. Why do you think that there's still a kind of resistance to that? I mean, there's still people. Are people just not interested, or they're just not like, I'll be fine, it's not a big deal, or I'll just take a pill and it'll be fine? Or why do you think that there's still some, not that hasn't totally captured the hearts and minds of a lot of people, nationally?
Well, I guess I always think in both complicated and simplistic terms. So on an individual level, why people are making the choices they're making is hard to know, right? I mean, that there are lots of things at play for people. I think at the broadest level, that sort of combs all the way down to the individual level, is that just a major driver is poverty. And so if you look at screening rates of mammography or pap tests or colonoscopy in the top 10% of Americans, it's astronomical. It's not that we're bad screeners, it's that we're poor. A lot of our country is poor. And when you're poor, or even just financially stressed, you prioritize decisions, or you have bandwidth problems because you're so worried about the stress of the next paycheck, et cetera, that you ignore certain things or can't deal with certain things or make bad decisions about certain things. And those things are sometimes related to your health. So when you look at rates of screening, again, it comes back to these poverty problems. Poverty is sort of a simple understanding that I have of United States health, right? That we're really divided by poverty in terms of life expectancy, all the way down to, which is a sort of population measure, life expectancy. It's sort of a whole group of people, how long do they live, all the way down to the decisions of getting screened. And when you layer onto that bad water, bad air, and bad food are also sort of almost the sole property of low-income people in the United States, that they can't escape bad water, bad air, and bad food as people who have money in the United States, that until you address poverty at scale, unfortunately, you're going to have major health differentials in the United States. And I think that's really the difference between 1990, when we had an average life expectancy that was like Europe, and now. We are a divided country now. We are a multi-tier, but simply a two-tier country between people who have high income and low income. And it's driving lots of policies and politics in the United States, but it's also driving health. So that's what I would say. So when you say, why is it that we don't do screenings? I would say that a lot of people do screenings. Now, there are examples where, income may matter less. And that's when things again get political, right? When you talk about vaccinations in the United States, COVID vaccine rates at this point are pretty good among many kinds of low income people. So there are other factors besides income within the low income. There's great divisions based on politics and other things. So individual decisions are driven by lots of things besides poverty, but overall poverty is a big player in the public health problems of the United States.
Yeah, I absolutely agree. I know you mentioned in the book too that class and more specifically, you're saying poverty is a huge is a huge kind of variable in the mix there. I want to ask about the pandemic and COVID. You can kind of we've kind of hinted at it or touched on it a little bit, but let me just ask kind of a blanket statement. In terms of all the things, right? Right afterwards, with shutdowns and masks and all that stuff, and then, now vaccines, and we've had different iterations of what is, kind of standard for respiratory pandemic, right? There's kind of waves to this. How do you feel as a country? I'll just say that, not necessarily politically or anything like that. How do you think? And again, this is global, so it wasn't just the United States. So, but as a country, I mean, how do you think? On all these fronts, it went. If you were to give if you're a professor here and you're giving a grade, for us as the U.S., how did we handle this? In real time and afterwards, did we? What's the letter grade we get for dealing with this?
So this expression for people with COVID, the people who were some of the people who were at risk, particularly for COVID, were those who had underlying conditions. That phrase, right? Underlying conditions.
Yeah.
Well, I think we as a country have certain underlying conditions. And the underlying conditions dictated part of our response, particularly in the first year pre-vaccine part of the pandemic. So, you think of a pandemic as being sort of an equal opportunity destroyer, right? 1 million people dying, it's going to be equally spread because it's just your bad luck that you get in the way of a COVID. Again, this was particularly in the first year when we were sort of less defended because we had no vaccine. And so, it wasn't an equal opportunity destroyer, COVID, right? It was a story of certain people getting it worse than other people, right? That suffering was unjustly distributed in the United States. And so who bore the brunt of COVID in 2020, the first year? Well, it was the old, and it was the homeless, and it was the prisoners, and it was the essential workers, and it was the uninsured, and it was people of color. And, those were the groups that died of COVID during 2020. And we had underlying conditions that have never protected those groups from all sorts of health tragedies, and COVID got to them, terribly, sadly, and a million of them. And that's number one. Number two is what happened after 2021, which was when we had a vaccine, and then the world split again. The health world split again into those who were vaccinated and essentially pretty much stopped dying, and those who were unvaccinated and constituted the bulk of deaths. And we know what happened there again, which was primarily for very odd and unusual political reasons involving misinformation that began with the last president, that we had some problems post-vaccine. So that's number two. Number three is that, when you think back to polio, right, we had a sort of shared national tragedy, but COVID was never seen as a shared national strategy. You never heard, getting back to the theme of me versus us, you never heard, well, we're all in this together, that this is some shared collective experience. No, the world split up into lots of things, right? Essential workers who were exposed and wealthier people who could stay at home. So, things split up, red states versus blue states with different policies. So that's number three. Number four is that our public health infrastructure has always been, a patchwork of state-led systems. We don't have a single public health system like many countries do. We have, at least 50 public health systems, and probably, many more led by state health departments. And that was inherently unsuited for national collaboration, which was the only way to sort of deal with the early parts of pandemic. And then, of course, we happened to have a pandemic at the low ebb of our pro-social world, right? We were already a divided world. And so, during the pandemic, you have legislation further limiting the authorities of public health officials. Half the states passed laws restricting public health powers, so that nobody could ban. So you weren't allowed to ban masks or have vaccine mandates, et cetera. So it was a sort of constellation of problems and underlying conditions, as I said, that drove the pandemic in 2020. And what's happened since then is, bad, but not as bad as that first year.
Yeah, no, I absolutely agree. So I guess here, in terms of the end of the book, you kind of start giving some ideas here, and you talk about how public health is a process and a practice, which I thought was really interesting.
Yeah, super important to understand.
Chat about that a little bit. How do you mean by process and practice?
Yeah, so this is a really important confusion in public health, because I keep saying what public health, and your audience may be going, I still don't know what the hell public health is. So let me try to help you with that. So what I would say public health comes in two parts. The first part is sort of a perspective. It's an aspirational part. And it says, we're concerned about populations, not one by one. We're concerned with preventing illnesses across that population, because that's how you extend life, not take care of people when they're sick. And number three, in this sort of perspective part, is we need to do this only by political policies, which allow you to address big health-causing issues at scale. So that's the aspirational perspective part of public health. It's populations, preventions, and policies. Now, that's separate from the actual work of public health. And as I said, the actual work of public health, there are hundreds of thousands of public health workers employed almost entirely, if you sort of think of it in the cleanest way, by your tax dollars, by governments at the federal, state, county, and local levels. So we have this very decentralized public health, quote, system, where people have jobs in public health departments in those cities, counties, and states. And what do they do all day, right? If you got rid of them, like we talked earlier about sort of getting rid of fire departments, what would go away? Well, what would go away if you got rid of public health departments? Well, what would go away was, you would no longer have water testing for your lakes where you swim or at your campgrounds, let alone for your drinking water when something goes wrong in a Jackson, Mississippi or a Flint, Michigan. You would have no testing of restaurants for food poisoning clusters. You would have no vaccination clinics. They would go away, and you would then be dependent on long lines in front of your pediatric and medical offices. You would have no anti-smoking campaigns. You would have no anti-obesity campaigns. If there were an HIV outbreak, you would have nobody to deal with it. So people who do public health are doing everything from, at the very local, very specific level in your community in ways that are invisible to you. So that's the actual work of public health. So again, two parts: perspective, aspirational part, and who we're concerned about in public health, and then the actual work of public health workers. So when I use the word public health, I'm sort of walking back and forth between both of those aspects of public health.
Yeah, and I think that's really important, because I think when people recognize that, they, okay, well, that's something I can kind of get my teeth into, and that makes more sense. It's like, okay, maybe there is some space where we can hold two perspectives at the same time, which is kind of what you do at the end of the book. So I guess my last question here is a very forward-thinking question, right? And you can have as much runway as you want on this. I guess, where do you see, we're still at the, kind of the coming out phase of the pandemic, right? And then we'll eventually hopefully get to a phase where in a couple of years where we're, kind of much further from it. But, so there's that piece of it. And then there's many other, kind of what you're saying, underlying conditions as well that have already been there. But, where do you, I guess, see the future of healthcare and the future of public health, both at the individual and I guess at the bigger social level in the U.S.?
Well, I care less. Let's start with healthcare, because I care less about it. It seems relatively untractable. There's just too much money and too much complication. And I don't see that going away anytime soon as health systems get bigger and bigger and more powerful and more sort of money conscious. And so, until very brave mayors or very brave governors sort of try to change those systems, it's really a pretty hard to move. So health care is really hard to move. I think that public health is very movable. And, the place where I think your listeners have to think, since they're not actual healthcare workers, they don't do that work, is really how do I, as a person, take an interest in public health? And the answer is through your politics and who you vote for. And that comes along every election season, because the policies that we decide on, whether they're city policies or state policies or federal policies, are really driving health in America. And those have to do with who we're willing to fund and what policies we're willing to fund, how we deal with housing in America, how we deal with air pollution in America. Coming to your corner soon is how we deal with climate change in America, which is going to have dramatic public health impacts and already has. Other policies we've talked about, like paid sick leave, is very important. Obesity, we haven't talked about during this hour very much. Obesity is a public health problem. There's one where healthcare has absolutely done nothing good, right? I mean, we have failed through the healthcare system. Or any of our systems, we spend billions of dollars on diet books and now medications and now surgeries, and yet 50% of our population is obese, worse than it was years ago when we started to address this, which tells you that sort of the standard approach to these things through what I would call the healthcare system aren't going to work. And so why is it that we can't lose weight? Well, it's not that every American has no willpower and it's just so hard. But, if you were an individualist, you would say, well, yeah, 50% of Americans have no willpower. Well, I don't believe that. I don't make this an individual thing. I think this is a system-related problem, that we have a food system that dictates the production, processing, distribution, preparation, and consumption of food. And if you're trying to diet in America, you're going to fail in most cases because of the type of food and the quantity of food that we consume for social and cultural reasons. Well, there's nothing in healthcare that's going to make that better. And if you want to fix obesity, which drives diabetes and all sorts of life expectancy issues in the United States, it can only be done through interventions at the higher levels, corn and sugar subsidies, other economic regulations, et cetera. Again, we can ignore that and think that it's up to 50% of us to make individual decisions. But my attitude would be that policies matter. And if we can create a world that allows dieters to have an easier time to diet, they're more likely to be successful if they want to lose weight. And that's where they are. And by the way, these legislative interventions, as I would call them, like addressing obesity, which can have major differences in the health of cities and states and people, have a great rate of return. See, that's the irony here of all of this. If you pay for more medical care, the rate of return in terms of sort of how you save money in terms of health, the rate of return for health care is just terrible. Whereas the rate of return for, a tax on sugar sweetened beverages is like $55 for every dollar you spend as a legislator. Well, you don't want to do that because, it upsets your sugar subsidies and corn subsidies. But in terms of sort of pure health, these are policy decisions that our politicians have to make. So to get involved in public health, my optimism about public health is that people will start to see that lots of decisions that their legislators are making have direct and very often indirect effects on our health as a population. And if you think about your votes in those terms, in addition to all the other reasons we vote, I think that's the hopeful way of thinking about this, because that's the way we get better. We're only going to get better collectively. Otherwise, the wealthier people in the United States will have top-notch life expectancies, and the less wealthy people in the United States will have terrible life expectancies. And it's our choice. These are fixable problems slowly because they're gigantic problems, but they're fixable if we pay attention and put our minds to them thoughtfully.
Yeah, no, I absolutely agree with you. I think that there's so many things that are at play, even with the thing like food and diet, nutrition, and things like that, and then what that means for all these issues. That's one example, but there's many other examples, and I agree. I think that there's many structures that are at play that you're right. They need to take courageous, mayors or governors or things like that, county executives, to try and push that along. Trying to do it kind of this patchwork kind of way of doing it isn't probably going to cut it. Well, the book is called Me versus Us: A Health Divided. I know it's out everywhere. It's from Oxford University Press. Where can people find you, whether your work or anything on social media? Where's the best place to find you?
Yeah, you can go to my website, michaelsteinbooks.com, and read about the other things that I've been thinking and writing about. And you can email me through Boston University. And those are two good ways to find me. And you can find my book probably most easily online. Just plug in Me versus Us, and you can find it at your indie bookstore or your giant commercial bookstore or the press itself, anywhere you like.
Yeah, no, that's great. Well, thank you so much for coming on. This was an absolute wonderful conversation and very important one. So I'm glad we had it.
Thank you so much for having me and these excellent questions.
All right. Thank you.